Hello, my name is Siobhan Heafield and I'm the Regional Chief Nurse for NHS England and NHS Improvement in the Midlands region. Every year on the 12th of May, we celebrate International Nurses Day as a recognition of all that is nursing. Not only is it the day that we celebrate and recognise nursing, it's also the birthday of one of the most famous nurses, Florence Nightingale. 2020 marks the 200th anniversary of her birth and was planned to be a year-long celebration of all that is great in nursing and midwifery, and to recognise both nurses and midwives globally. Nightingale is most often remembered as the lady with the lamp and the role she played in the Crimean War. I'm sure many of you, like me, have reflected on that irony that in 2020, when we would be celebrating the bicentenary of her birth with the proposed Year of the Nurse and Midwife celebrations, we find ourselves in the midst of a war ourselves against a virus that has caused a global pandemic and that will have a lasting effect and influence on how we practice nursing now and forever. Whilst there is irony, there are also many similarities to reflect on, not least the setting up at great speed of the Nightingale Field hospitals across the country to provide additional capacity and support to NHS hospitals and specifically to the intensive care capacity. Florence Nightingale had many strengths, characteristics and values that we are all familiar with, and these are also so evident in what we're seeing in our nurses and midwives today. Leadership, implementation of high standards of hygiene, courage, evidence-based working and data collection to support it. All of these are so important and will continue to be at the fore of nursing in the immediate management of this pandemic and for the foreseeable future. Thank you, nurses, past, present and future, for all you have done and continue to do, including those that have made the ultimate sacrifice. Just wanted to say something about data collection and evidence-based working. Sometimes data collection feels like a burden. When I'm out visiting nurses, that I often hear them say, we don't have time to collect data. And my response back is, we don't have time not to collect data if we want to be able to demonstrate what a great job nurses do and demonstrate the quality of care provided. Only a few days ago, one of the clinical academic nurses from one of the trusts in the Midlands put out an appeal to nurses and midwives and health visitors across the UK to ask for their insights as experts to inform research projects and priorities during the COVID-19 response and beyond. I've spoken to the team at the Trust and they've already had over 600 responses making suggestions for priorities. This is really good, and it's really important that we support our researchers to help focus on what we all believe matters. One of the areas where data collection will be of the utmost importance, both now and in the coming months, is in relation to our BAME colleagues. Last week, along with the CNO Senior Advisory Group for BME colleagues across our Midlands, I took part in a BME listening event for BAME nurses. Along with my colleagues Manjit Darby and Miriam Coffey, we heard about the understandable fears and anxieties of this group of our colleagues. We have committed to supporting this vulnerable group of staff through this very difficult period. One of the ways we will be supporting them is with the empowerment through shared governance, and this will be embracing the experience and support of the wonderful and inspirational Aqualine Chivanji from Nottingham University Hospital. Several things have struck me over the period of the pandemic. How staff, not just those at the point of patient care, have stepped up into roles which were only a few weeks ago unfamiliar. I've certainly seen that in our incident room that we run across the region. How military colleagues have become embedded into our teams and become very much part of our teams. How family, friends and neighbours have rallied to check in on the NHS staff and other key workers to help in any way they can, not least Thursday Clap for Carers. I'm personally very grateful to my sister because she's doing our ironing. Of course, we're social distancing and leaving it on the doorstep. I would finally like to say thank you. Thank you to all the nursing and midwifery and health visiting staff who work hard for all of the patients across our region each and every day. Thank you to the fabulous team I have in my directorate who support me each and every day. I'm very grateful to all of you for what you do for me. And a huge thank you to all of the directors of nursing across the region who provide support and leadership to all of the nursing teams in their trusts and organisations, and also give me personally a huge amount of support, respond to urgent requests I send, influence and guide national thinking, and also keep me grounded in the reality it is for you. Finally, I'd like to thank each and every nurse, midwife and health visitor in our region for all that you are doing, not just in these trying times, but day in and day out, and that you will continue to do this. So happy International Nurses Day. Thank you.